The gastrointestinal mucosa membrane is essentially our largest surface area that separates our internal body from our external world. And because of this, there's a lot of detoxification across the epithelium of the small intestine, which helps protect our bodies from pathogens coming into our gastrointestinal tract. Some risk factors that are associated with predisposing someone to a food intolerance are going to be associated with things that would break down that integrity, that mucosal lining in our small intestine, the barrier that helps keep us from being overly exposed to chemicals. For example, alcohol consumption and non-steroidal anti-inflammatory drugs. These are two known drugs that can and do break down the natural barrier in the small intestine with overuse. Another factor is dietary, overly consuming sugars, simple sugars that feed specific bacteria, flora inside the small intestine and creates an overproduction of this flora. Those are some examples of risk factors. Some symptoms that are associated with leaky gut, again, are quite vast and overlapping. It can be anything from physical, mental, emotional, poor ability to adapt to exercise. You cannot lose weight, hard to lose weight, hard to gain weight potentially. Overall inability to properly detoxify and regenerate the body are some symptoms that are associated with having a food intolerance. Some healing options to address a food intolerance is quite complicated. The 4 easy foundational factors that need to be worked on despite any other treatment are going to be nutritionally, are you eating properly for your metabolic needs? Physically, are you exercising enough? Are you getting enough movement through the lymphatic tissue to initiate detoxification? Are you sleeping properly? Are you getting enough regeneration, since sleeping is where most of our physical and neural regeneration occurs? And also your lifestyle factors. Are you having a lifestyle that is not overly stressful and is manageable and in line with who you are and the things that you want to do with your life?